For the muscles of the lateral aspect of the leg, we have two muscles, the fibularis longus and the fibularis brevis. They are so-called the peroneus muscles. These two muscles help in foot plantar flexion and foot eversion. The fibularis longus originates from the head of fibula, proximal 2/3 of lateral surface of fibula and intermuscular septum, and inserted in the medial cuneiform bone and metatarsal bone 1, innervated by the superficial fibular nerve and blood supply from the fibular artery. The fibularis brevis muscle originates from the distal 2/3 of the lateral surface of fibula, anterior intermuscular septum, and inserted in the tuberosity of the 5th metatarsal bone, innervated by the superficial fibular nerve, while the blood supply is from the anterior tibial artery. Adding some clinical correlations to the fibularis longus, we have the peroneal tenosynovitis, which is a pathological condition affecting the common peroneal tendon associated with fluid accumulation within the tendon sheath. Clinically, it presents with localized swelling and tenderness along the tendon sheath itself. Acute peroneal tenosynovitis is typically seen in athletes who resume their activity after a layout. It can have a variety of causes, including the stress around the retromalleolar groove, peroneal tubercle or undersurface of the cupid bone, ankle inversion injuries, lateral malleolar and calcaneal fractures, finally tear of the calcaneofibular ligament. The location of the fibularis brevis renders it susceptible to injury. Over time, it's exposed to shear stress while gliding between the lateral malleolus and the tendon of fibularis longus. So, if the foot becomes over-inverted, the excess downward force will be applied to the lateral part of the foot, causing tears or rupture of fibularis brevis tendon. These injuries are seen among basketball, tennis, and football players. If the tendon of fibularis brevis ruptures, it can also cause an avulsion fracture of the 5th metacarpal tuberosity. A micro tear in the fibularis brevis tendon can over time result in fibular tendonitis. This is often characterized by pain swelling to the posterior lateral part of the ankle and foot. The pain is indolent and worsens with exertion. Acute management of this problem involves resting the limb, applying ice packs to the affected area, compression bandages of the ankle, and elevation of the limb. Non-steroidal anti-inflammatory drugs can also aid in alleviating the pain. Physiotherapists recommend that individuals perform adequate stretching prior to starting strenuous activities. This helps to promote collagen synthesis and muscle fiber organization, thus strengthens the muscle.